Hi, welcome back. Let's go over the peak flow meter. This device is very important, especially in asthma. This is because it gives early objective warning signs that the airways are narrowing before symptoms even appear. This makes it one of the most powerful self management tools for asthma. A peak flow meter is a small handheld device that measures how fast a person can exhale or breathe out. It helps determine how open or narrow the airways are and can detect worsening asthma before symptoms appear. Peak flow meters are recommended for moderate to severe asthma to monitor airway narrowing, helps with detecting signs of asthma flare, or even determining if the patient is responding well to their bronchodilators, if the patient is being exposed to asthma triggers based on the changes in their readings, and the doctors can also use this as a tool to come up with an action plan for the patient. How do we use the peak flow meter? So you'll have your patient sit upright consistently each time they use this test. The test is best done before taking any bronchodilators unless the doctor says otherwise. Before they start, they have to reset the marker to 0. Take a deep breath, fill lungs completely. Seal your lips tightly around the mouthpiece and then blow out as hard and as fast as possible in one quick blast. Remember, the patient blows out, not in. This is because asthma is an obstructive disease. The flow meter will measure how fast and how long the patient can breathe out. The shorter the time, the narrower the airway. And the longer the blowing time, the more the open the airway is. Open airway means a well-controlled asthma. Narrowed airway means an uncontrolled asthma, and the higher the probability of getting into an acute asthma exacerbation. So, after blowing out completely, record the number and repeat this 3 times. After the third time, you record the third reading and then use the highest reading among the three. Do not do an average. You will see this in an exam. We use the highest reading, not the average. Record symptoms, medication use, and triggers along with the reading. The test is to be done twice a day, preferably morning and evening. How will the patient determine their personal best? Personal best is the highest peak flow achieved over 2 weeks when asthma is well controlled. So, initially, when the patient gets their flow meter, the doctor still doesn't have an action plan. So, they have them go home with this device and use it for 2 weeks, morning and evening. They do every instance when they have to do it, they have to do 3 tries, morning and evening. So, that's a total of 6 tries per day, and then they record their personal best. The patient will test twice daily, morning and evening, for 2 weeks. The test should be done before taking any bronchodilators unless the doctor instructs otherwise. The patient should use the same flow meter each time because different brands may vary. Note that all future readings will be compared to this personal best because the main reason for doing a personal best challenge is to determine what's the patient's personal best throughout the 2 week period. The doctors will take that and use that to come up with an action plan. To find your personal peak flow, you should record the highest single number you achieve over a 2 week period when the asthma is well controlled, not an average, as this highest value reflects your lungs' best possible performance, which your doctor uses to come up with an action plan. So, let's go over the action plan. An action plan is a personalized written guide created with your doctor that tells you exactly how to manage your asthma daily. It also helps with recognizing worsening symptoms and what to do during an asthma attack, often using a simple color-coded system, green, yellow, and red, to indicate zones for good control, caution, and emergency action. The patient falls in the green zone when they blow in the peak flow meter 3 times and their highest value falls within 80 to 100% of their personal best given by their doctor when they did the challenge, the 2 weeks challenge. So it's compared, whatever reading you get will be compared with your personal best when you did that 2 weeks challenge. So if you fall in the green zone, it shows that the asthma is well controlled and therefore the patient should continue with what they've been doing, including taking their daily maintenance inhalers even when they feel good. They should also avoid triggers. The patient falls in the yellow zone when they blow in the peak flow meter 3 times and their highest value falls within 50 to 80% of their personal best. What does this mean? The patient should be cautious as this signals that the airway is starting to narrow down. They need to follow their healthcare provider action plan, which usually requires them to use a bronchodilator, albuterol, and wait 5 minutes and take an inhaled corticosteroid and then repeat the test. If after repeating the test they don't fall in the green zone, then they need to call their doctor for the next step. If the patient best of the 3 tries falls within the red zone, that is less than 50% of the personal best, this is a danger zone. They need to call 911. It is an emergency because this signifies a severe airway narrowing. After calling 911, they should take a rescue inhaler, SABA, albuterol, which is a quick relief bronchodilator, and follow up with the inhaled corticosteroid as they wait for help. That's it. I hope this helps you recap what you have learned in class. If you haven't subscribed, kindly support your girl by doing this. Subscribe, like, and comment, share my content so that YouTube can push it to other students who can also benefit from this amazing content. Thanks for now, and I see you on the next one. Bye.